Hi. I talk to my patients a lot about stress, and I know I've talked about it here too. Stress is a really important factor to take into account whether you're trying to conceive or if you're just dealing with perimenopause or postmenopausal symptoms. The thing with stress is a lot of times people think I'm only talking about mental stress. Or maybe emotional stress. And often they'll say, "Oh, no, I don't have any stress." And I'm thinking, I know that's not true. Because just trying to get pregnant in and of itself when it's taking a longer period of time causes stress in and of itself. But there are other things that I have people coming in with that are also stressors on the body. And so it's not just the mental part of the stressors, it's also the physical. And sometimes it's organ system. And so I have several patients right now that have all been diagnosed, finally for fatty liver. And fatty liver, you might go, well, what does fatty liver have to do with stress? But fatty liver is anything that's stressing your internal organs is a stress on your system. And so you kind of have to look at it both ways. And I'm not trying to stress you out by talking about this, but it's an important thing to keep in mind is what your internal system is doing. And so if you have issues going on with the liver, which fatty liver is one of those things that actually non-alcoholic fatty liver disease is higher. More people have that population wise than they do the alcoholic fatty liver, surprisingly. And you're like, well, how is that? And it's because with the liver, if you're having a lot of carbohydrates, a lot of sweets, that are in your diet, could be processed sugar, could be just even a lot of fruits that are highly concentrated with sugars, that can also cause your liver to store. And what it does is it stores sugars, but then if it's not getting utilized, it tries to put it back out in the system, still not getting utilized, turns to fat in the liver. And so you can keep getting more and more fat showing up there. And so this is just one thing I'm talking about is fatty liver. But the thing about the liver is what helps convert hormones like estrogens into safer hormones in your body. And sometimes the imbalance that goes on with trying to conceive is about that hormone regulation and making sure that you don't have too much estrogens, which could actually bring down your progesterone levels, which are really important during the time of the luteal phase for both implantation and maintaining pregnancy. So the liver is an important area. And so really taking good care of it is something you need to keep in mind. But that's one thing. I also have patients that come in with pain that are trying to conceive. And so if you have low back pain, or if you have knee pain, or if you have any areas of sprains, strains, breaks, etc., those are also physical stressors. And so that also creates mental stress, whether you realize it or not, because if you're walking around and it hurts every time you take a step or you use your arm or shoulder, it's something that you're like, oh, it's a stress. So the reason why I'm bringing this up is the need to take care of yourself. For fertility, it's not always just about your uterus. You need to, and your ovaries, you need to make sure that you're taking really good care of yourself in all the ways so that your immune system is strong, that your organ systems are staying at at their best performance, and that you're also even your joints and stuff, you're taking care of yourself there too. So whatever supplemental aspects or stretches or physiological work that you have done, so I'm talking about like a physiologist or someone who's doing whatever training help or joint help, that you're taking really good care of yourself. And the holidays always seem to bring like added stressors. So what I'm talking about here is also doing things that will help mitigate stress that way. And so make sure during the holidays you're taking good care of yourself, drinking lots of good water, eating lots of good vegetables. And I know this always seems like the worst time to tell people to take good care of themselves with eating habits, but it can be done where you just give yourself small treats. Nothing too big. You just give yourself a small treat. And then otherwise, you're really trying to be good. So you're getting in those good vegetables, those lean proteins, those things that help your system thrive. And that's a really good thing to do. And then also keeping your stress level down as far as the trips. how much you're putting yourself out there for tasks when they're very stressful. So the mindfulness factor of like how much you're putting into things is another thing that's really good to keep in mind and, kind of lessen your stress that way. Don't take on so many tasks. Be okay with doing a little bit less than you normally would and find other ways to deal. I shouldn't say deal with the holidays, but take care during the holidays. Really give yourself some positive time, watch the funny Christmas movies or whatever funny shows, laugh more deep breathing exercises, get out there and get some sun, take a good walk and see some pretty things. Just really feed your feed your system with some positivity. The other thing I wanted to mention is for those that are San Diego locals, I do have a special that I'm offering. It's a stress reduction treatment. And so you come in, and actually with this one, I set it up where it's a no needle one. So you're getting cupping, which is really good for relieving stress in the back and neck. You get some neck massage as well, red light therapy, which is really good for healing internally. And then also there is one more step with it's an Alpha-Stim, which is actually little things that go on the ears, but they have a little stimuli that also helps your body reset back from sympathetic nervous system where you're all to a more parasympathetic state where you're in feed or breed or rest and reset. And so that's really important. And I think this is a really great either gift for yourself or for somebody else. But I also have like a special deal too, like if you get three. So if you're local, it's a really good thing to take in and just really treat yourself to something that's going to help lower your stress and make you feel better. But otherwise, if you're not local, please take care of yourself. If you have those options to maybe go get a massage or foot massage or just self-care at home, all that is going to be good for you. And also the other thing I would say is if you're not sure about what's going on with liver and other internal organs, getting lab testing done and finding out what the status is can be really eye-opening. Some people don't even know when their blood sugar is starting to elevate more. And it's not just about glucose, it's actually hemoglobin A1C, which is the marker for insulin resistance. And so if your doctor actually tests that, then you can see, oh, okay, I don't have to worry about that. That level's good. Or, oh, I need to start paying attention because my blood sugar levels are starting to tweak up a little bit too high. So I may be at risk for things like diabetes in the future. But you're just trying to like take care of things now so they're not getting elevated to areas or to levels that are going to be unhealthy for you. And so also looking at the liver, a lot of times with the tests that are done with a regular panel, we'll do liver markers. And so that can also be really helpful because then if you never know, you don't know what to change in your diet and lifestyle. So definitely having a more thorough look and not to be scared of, but just to be, oh, okay, now I know what I need to do. A lot of times people avoid these tests because they're fearful of what they'll find out. But really the long and short of it is if you find out what's going on and you're able to fix it before anything goes further along, then you're ahead of the game. And so I would definitely highly urge you, if you have a doctor who will do some tests with you, or if you want to work with me personally, I do both coaching and I do assessments. And so I do work with labs all the time. And so anyway, I just want to make sure you're taking good care of yourself, especially during the holidays, because it can be rough then. And then also going into that new year with a lot of positivity. All right, you take care, and I hope you do have a good holiday.